Wait, there's adding new
More,
backstory here.
This is our second week now of the Global Child Health Lecture Series. So today it's my pleasure to introduce Dr. Paul Krezanoski. He is a professor of medicine and pediatrics at UCSF and has only recently, I found out this morning, moved back from Uganda. So he has 20 years of experience working in a variety of places: Madagascar, Uganda, Cote d'Ivoire, Eswatini, and Uganda. He has expertise in malaria prevention, which is what we're going to hear about today, and innovative global health technologies. He's also been a mentor for one of our prior pathway residents who had the good fortune of getting to work with him. So very excited to have you here in person. Last year he presented from Uganda. I think it was like 3 o'clock in the morning your time, so it's great to have you here in person.
That's great. Yeah,
Thanks
this
so
is much easier timing for me. So, hi everybody. Thank you for that presentation, Teresa. I'm going to talk today. It sounds like you're already in your second week of your pathway and starting off on a new year. It's exciting. I'm going to talk about malaria today. I don't know, you may have already gotten some malaria, but I focus very specifically on malaria prevention. So not necessarily on treatment, but more on how we prevent malaria. And that's what my work focuses on. I focus mostly on bed nets and how prevention of malaria with bed nets overlaps with exposure to mosquitoes, exposure to malaria. So we'll get into that. And we'll take it from there. So a couple of things I have to say is that first, I run a small nonprofit organization that has funded some of the work I'm going to present. So I need to disclose that. I don't get paid for that work, but it's something I have to let you all know. In addition, I invented a device that does bed net monitoring, which we'll discuss more. That also does not make me any money, but I have to tell you about that as well. So this is the outline of what we're going to talk about today. So first, I'm going to give a broad overview of malaria. You may have already gotten some of that. We'll talk about bed nets, talk about a conceptual framework, how I think about bed nets for prevention of malaria. We're going to talk about studies that I've done or approaches that I've taken to try to understand bed net ownership, and then also moving into bed net use and trying to distinguish those two things as important outcomes. Then we'll talk about some tools that I've been working with to do bed net monitoring, and then some of my more recent work in that area. So, malaria. So in 2022, there were more than 200 million malaria cases and about 585,000 malaria deaths worldwide. I think that makes, in many countries in sub-Saharan Africa, makes it like the third highest, at least, infectious disease killer, with HIV and TB being the worst. This is a graph showing that although we had a significant decline from 2000 to 2015 of malaria deaths and malaria cases in general, since 2015, so now we're going on almost 9 years, there's really just been stagnation. And at this point, 95% of all malaria cases and all deaths are occurring in sub-Saharan Africa. Not just that, but children are bearing the burden of malaria. So age structure and age in general will become an important theme throughout this presentation. But over 75% of malaria deaths occur in children under 5 years of age. Mostly that is because by the time a child makes it to 6 or 7 years, they've been exposed to malaria so many times that they develop an acquired immunity to malaria. And the reality is that proportion has not changed over the last 7 years. So basically you can think of, since 2015, malaria has now become a fixed problem in sub-Saharan Africa among children, which makes it an important thing to focus on. Oh, that's the wrong direction. So what do we do to prevent malaria? So the long-lasting insecticide-treated bed net has helped to reduce malaria. It was a significant part in reducing malaria from 2000 to 2015. The original randomized trials in the 1990s, where you took out just a typical net and added an insecticide to it, showed really remarkable effects, reducing child mortality in some controlled studies by like 20%, 70% reductions in malaria incidence over time, and a significant contribution to reducing malaria. However, you'll note that since the last 9 years, we've been using better and better mosquito nets without very much effect. So it's not quite enough to get us to wiping malaria out. So this always blows my mind, but 200 million bed nets are distributed every year, approximately. And the WHO has called for everybody in the world that is at risk of malaria, which is around 3.2 billion people, to have access to bed nets. So these are incredibly common. I mean, I think I'm not quite like toothbrushes, but in terms of like health prevention, positive health, health prevention tools, they're very, very, very common. In sub-Saharan Africa, they're everywhere. It's not where I work. So how do bed nets work? Some of you may have traveled and slept under them. Some of you may not, but essentially bed nets are these tools here, the cloth that you put around your bed, at night when you sleep. So when you go to bed, you tuck it around your mattress. That's the best practice way to use them. They provide an individual protection, so they protect you from mosquitoes by creating a barrier for mosquitoes to actually get to you, right? They also have an insecticide on them, so those mosquitoes that were trying to get you will eventually die. Some insecticides will kill them right away. Some will kill them like a day later. And so those insecticides actually can reduce vector populations, reduce the number of mosquitoes that are around. There's also this idea of a community-wide effect. So if I use a bed net, I'm also kind of helping you in your house next door because I'm killing mosquitoes and preventing both transmission of malaria, and I'm killing the mosquitoes that might come and get you later also. So there's a really interesting kind of economics, kind of community effect that's involved as well. So this is a framework that I've been using for a long time. I started working on bed nets as a Peace Corps volunteer. I was living in Madagascar, and at that time, there were not a lot of bed nets in the community. So we're going to talk next. I'm going to present a couple of studies that I did based off that work. But my basic idea was that first you have to address two important questions. You have to get the bed nets into the house, right? It's kind of like a supply side. How do we get the bed nets that are supposed to prevent malaria from their factories or wherever they are into someone's home? So that takes a certain level of demand from the household, right? And then the second piece, which is somewhat more interesting for me and when I'm doing my most recent work on is, so then once the bed net's there, which nowadays bed nets are massively, universally distributed, how do we get people to use them? How do we understand why people use them or don't? So we're going to talk about both of these aspects in this presentation. But clearly you need both to actually prevent malaria. That makes sense. So you can't just focus on dropping bed nets off at people's doorsteps because then they won't necessarily use them the way they're supposed to. So what are some barriers to getting the bed nets into the household? So we're on that like first step first. So one is malaria knowledge. Maybe people don't know that malaria actually comes from mosquitoes. And so they're like, why would I need a bed net? In Madagascar, there was this very common belief that malaria came from eating unripe fruits, which sounded kind of crazy to me. But then you think, oh, unripe fruits is around the rainy season, the time when people get malaria. So there's a lot of education that you can do to help people understand how to prevent malaria. Another potential barrier is availability. Obviously, if your supply chain is not working well, you don't actually have enough bed nets in your country or in your community or in your village, then you can't get people to use their bed nets. So maybe you need better delivery systems, and there's whole field implementation science research based on those. Another potential barrier is the cost. So when I did a lot of my original work, bed nets were not free. Nowadays, for most people and most households, you have universal free distribution. But initially, the cost of the bed net was an important way that the systems would recoup some funds so that they can afford to continue delivering bed nets. And so people were charging a small price, not the full price, a subsidized price. So I did some initial work. My wife, who's a health economist, and I did some initial work looking at comparing the prices of bed nets and looking at how that affects the demand to own one and your actually likelihood of using them. So that's what we're going to talk about next. So I did this work, started this work as Peace Corps volunteers, and then wrote it up some years later. But essentially, it was a randomized trial. We worked in 12 different villages in Madagascar and around where we lived. My wife was in the Peace Corps with me. So we had these 12 villages. You can see down on the left there, we basically had 5 different price points. You got every household. At this point, there were very few bed nets in these houses. Every household got a coupon, and they could redeem that coupon for a bed net at the price that was on the coupon. So some got them for free, some got them for 5,000 ariary, which was like $1. and then kind of going up to the market price, which is around $15. And then we randomized it by village, just cluster randomization. And then what we did is we looked at, based on redemption of those coupons, how many people ended up actually coming to get a net and how many ended up reported using the net. So that's this graph here. So in the blue is ownership. So that means that they actually went and got a net. They redeemed their coupon. And what you're looking at on the x-axis is the price of the net from free all the way up to the market price. And on the y-axis is the percentage of the households in that village. And first you note that everybody that got a free net, right? So everyone that had a coupon were able to go and redeem their net. However, if you'll notice here, there's a little bit of discontinuity between ownership and use. And this is something that comes up quite often. Vaccines is another common one. When you're giving things out for free, there's actually an economic theory that it reduces the value for people in their eyes. This is one potential explanation. I'm not going to say I know that that's what happened. But one potential explanation is that free things sometimes are seen as less valuable to people that are receiving them. And so for public health, you can imagine the importance of then either working around that, if you still want to give things for free, or perhaps charging just a nominal price, a very small price that they can afford, that gets them to put a little skin in the game and find value in what they're receiving. But that was the outcome of this. So our basic conclusion was that giving bed nets out close to free is probably optimal, because that gets most bed nets out, but it also gets you as most what we call conditional use if you own one as possible. So it was based on studies like these. This was a super small study that we actually didn't publish for some years, but there were a couple other studies much larger from well-pedigreed economists that showed that exactly this, that charging a small price is important, but it has to be close to zero. Too much price, especially you can imagine these poor houses, they just don't have the cash to go and buy a net, or it rapidly decreases demand, as you can see on the curve there. So nowadays, as I was mentioning, nets are mostly given out for free. So then I started to look at, okay, so I wanted to move on then to look at, like, how can we get people to use their bed nets, right? So we get them into the house, let's say we give them all out for free, or for a small price, enough to get them to want to have them. How can we get people to use their nets, and how can we think about the ways that the barriers around use of nets? So another kind of, using the same kind of economic approach, my wife and I came up with a randomized trial to use actually small incentives, like small prizes, to get people to see if we could boost people's bed net use. So behavioral incentives, nowadays, again, around vaccines particularly, that was it was in the news a lot, but in developed countries, there's a lot of literature around behavioral incentives, around helping people lose weight, tobacco cessation, even drug use, methamphetamine use, cocaine use. There's actual programs that will give people small incentives to keep on track with their goals. Does that make sense? In developing countries, especially around the time we were doing this study, there were some of these approaches looking at around child immunization, nutrition. However, there hadn't really been anything looking at encouraging the use of bed nets. And actually, there hasn't been anything since. And this study was done back in 2010, I think, 2008. So this was, I ran this study when I was in medical school. I went back to Madagascar, and in this case, we again cluster randomized villages. We had about 520 houses. Again, they got one coupon, but in half the houses, so in half, around 10 villages, we said, okay, we're going to come back and survey you in a month, and if you're using the bed net that you just got for free, we'll give you a small prize. In the control houses, we said we'll come back and visit to do a survey, but we didn't say anything about any prizes or incentives. And the goal was to see if that small promise of a prize would be enough to boost the use in those houses, get people to use their nets. Also with the idea that if you use your net a few times, let's say you got a free net, if you get a little bit of incentive to help you, like, oh, maybe I'll put it up, right? I'll hang it up, it takes a little effort. I'll use it a couple times. Oh, this is nice, I don't have mosquitoes biting me. You can actually learn the behavior as well. So we ran this study. On this graphic, you're seeing again. Sorry, this is all use, right? So now we're just talking about use. Every household, again, that got a free coupon went and got their free net. And now you're looking within 1 month, which is that little circle there. You're looking at a difference between 99% of the houses in the intervention, the one that we promised a small prize to, use their bed nets or were reporting using their bed nets, and 78% in the houses that did not get a prize. And I misspoke. It's not actually reported using their bed nets, because you can imagine if I say, if you tell me you're using your bed net, I'll give you a prize. And so people might want to be more willing to say they're using their bed nets, but actually was whether the bed net was hung up over a bed in their house. So that's actually the percentage you're seeing there. Interestingly, you'll note that when we went back again at 6 months, you see that the intervention house, the households, the solid line, the use actually declined a little bit from 99% to 93%, and that use in the control houses actually went up. So whether that represents kind of a reversion to the mean, like we kind of over boosted bed net use, like they actually 99% of the households actually don't want to use a bed net, maybe 93, closer to that, or some other factor, it's not clear. It is well described in the literature that incentives need to be regularly applied to have the same effect, like the effect wanes over time. So that's also what we can interpret this as, is that the effect of that initial boost kind of waned over time. Okay, so now we're going to move into a different, now we're going to talk more about some insights I had about how to better monitor bed net use. But I'll stop here for a quick second. Any questions about these studies, why we did these studies, or any thoughts on these studies? Yeah, please.
The baseline knowledge of why people don't use the bed nets, how did that inform the incentive intervention? So like, what were the most common reasons for not using bed nets?
Yeah, good question. So in this, so I don't know if the microphone's working. The question was, what was kind of the baseline knowledge, and then how did the incentive interact with that baseline knowledge? So in this area in Madagascar at this time, which was again in 2007 when this study was done, you can see in the very bottom left, 6% of houses had bed nets. That's incredibly low. So this was a very bed net naive population. We could also say maybe malaria knowledge naive as well, low malaria knowledge. A lot of the barriers to bed net use include misunderstanding of how malaria is transmitted. So not understanding that it's transmitted by mosquitoes is the main one. And then there are a bunch of like, I call them like structural things. So for example, it gets very hot in many places sub-Saharan Africa. This is now speaking broadly. And bed nets can feel a little stifling. You don't get like a nice breeze, you feel really hot. Some people just don't like, just feel stuck, what is it? Phobia of being stuck, stuck with stuff all over you. They're sometimes hard to remember to use, so people just forget to use them. They're annoying. Your kids get stuck in them. I just used bed nets for 2 years, so I know they're annoying to use. So those are the type of barriers. Then there's also misinformation in specific situations about like, I'm afraid of the insecticide. It's going to, just beliefs that aren't true about that it's going to make me infertile. Like, there's a whole range of beliefs. Just think about vaccines, same kind of thing. But in this particular area, it was a very bed net naive population. So they didn't really know a lot about bed nets at all. They were happy to get them though.
In this study, did you end up actually giving them an incentive, and what was
Oh,
that?
sorry. Yeah. So and I was very careful with what I said in the study and to you. So what we did is we promised people a prize. We just said, we'll give you a prize. And there's a Malagasy word for that. And then when we went back, we ended up giving them about $5 worth of household goods, like a bag of rice, some coffee, just things that they would use around the house that they buy at the market. And so which was valuable enough for them, but we didn't tell them what they're going to get. We didn't give out cash. People have done this and that's just one way of doing it. And that says more just about the level of poverty and level of what can move people. And there's a lot of research around, for example, a developed setting around what moves people. And there's also a lot of really cool schemes where you have people put money in themselves ahead of time. And I'm sure there's a whole literature on this that I've used to read more closely. But it's really interesting. A lot of different ways of trying to help. It's the idea of nudging people's behaviors. You have to be careful with, but at the same time, it can help people. It can help people do behaviors that perhaps they want to do eventually, once they learn that that's something that's useful for them. That's kind of the way I think about it. Okay, anything else? All right, how are we on time? We are doing okay? Okay, perfect. Cool, so this is my more recent work, so that kind of goes back in the past. So based off that, as I was mentioning, you were asking, I was specifying how we measured whether people were using their bed nets or not. And when you're giving incentives in particular, if you're asking people about using their bed nets, you may not get the best answer. So that got me really interested in how do we measure bed net use? So as I mentioned, a lot of money goes into bed nets. Hundreds of millions of bed nets are distributed every year. Bed nets are by far and away, even above drugs, the most expensive, the largest portion of malaria budgets, both at the country level, funder level. They're huge. And in particular, since we've seen this stagnation over the last 9 years, we're now investing in new insecticides, because one of the big theories is that the insecticides are no longer effective against the mosquitoes, and that's why we're seeing this flat line, remember, of malaria improvement. And those nets are more expensive. So bed nets are still a huge outlay in terms of a budget. So understanding how they're used is super important, because otherwise we're just shelling out things that aren't doing much. That's kind of how I frame my research, because that gets the attention of policymakers and people, people have to make these decisions. So what are the ways we measure bed net use? Traditional methods are surveying with self-reports. So I go to you on the morning, I say, hey, did you use your bed net last night? Or I ask the mom, did your child use their bed net last night? I mean, that's a common way. It's in the DHS, the Demographic and Health Survey, which is the kind of standard for health surveys. There's also a malaria-specific module. That's how it's typically asked. Or they'll ask, was this bed net, who used this bed net last night? These are all self-reports. So very common, but you can imagine some of the biases that may come in just self-reporting. We'll talk about that a little bit more. Another way is the visual observations. That's what we did in that incentive study. We actually look in the house and say, oh, would you mind, it's all with consent, would you mind if I look around and just see, each sleeping area, does it have a bed net over it? And that's a pretty good sign that probably they're using their bed net if they have one over their net. They've actually put it up. There are other ways to do this, and I've done some of these unannounced nighttime visits. We do them at 11 p.m. at night. Again, this is in a research setting. People know we're coming, but they know that at some point we might knock on your door and then walk around and see which kids are actually sleeping under a bed net and which aren't. And there's also nighttime observations where individuals, both researchers or even household members, will be tasked with sitting in the house and watching what time people get in their bed, how long they stay under their bed net. And these are actually really important research tools. It's not something you're going to use every day, but they're important research tools to understand, again, that exposure window of when it's occurring. The issue with these is that they're one-time measures. So, you don't get seasonal night-to-night or intra-night variations. Intra-night variations are things like interruptions during the night. So this study was in Peru, I think, maybe 5 or 6 years ago, but essentially this is the hours of the night down below, and you're seeing the number of times that someone got up during that hour got out of their bed net, essentially, and then went back in. So you can imagine people are going to the bathroom, there are kids crying, we have to go outside, there's lots of interruptions, a lot more activity than you think. It's not just an on or off. Seasonal variations is another huge one. We talked about a little bit about temperature. So when it's really hot out, people tend to use their bed nets less, the dry season typically. And when there's more mosquitoes around, people tend to use their bed nets more, unsurprisingly. And then a lot of these are very locally or culturally determined. And I put that here because everyone's moving now towards, instead of a one-size-fits-all policy, of actually what they call like locally determined policies, where you say, will bed nets work in this population? Right? You could just think of like an example of like nomadic tribes. Like it's very difficult to get them to use bed nets regularly because they don't have a fixed dwelling, right? That kind of idea, that every different culture will use and understand bed nets in a different way. And that I also find really interesting. That's why I like this part, because it's this idea of use, because it's a combination of both cultural, individual behaviors, household, right, behaviors, household culture, village culture, all the way up to like regional and country culture. I was an anthropology major in college, so I always liked that stuff. So one thing we talked about was potential biases with self-reports. So one way I tried to look at that was to do a meta-analysis. I found 19 studies that had both, well, basically every study has self-reports, like, did you use your bed net last night? I was able to find 19 studies that used what I call a more objective measure. So that's either, they also, in addition, that same population, looked if bed nets were hanging above a bed, or they did like those unannounced nighttime visits. And so then I compared the proportion that were using those two different measures to see if there was a gap. And so what you can see here is the trend from this meta-analysis to the right side, meaning a trend towards a higher use from self-reports, unsurprisingly. If you ask people if they use their bed nets, they're more likely to report that they're using it than they actually are. And what I estimate is around a 13% relative inflation of actual bed net use. That's actually kind of spookily the same number I arrive at in multiple different ways of measuring this with my own studies and stuff. So I would say around 10% overinflation is probably the true number. That also depends on, it's called social desirability bias. Like, I just gave you a bed net and then I come to you and like, hey, do you like the bed net I gave you? Right? You can imagine people are like, yeah, it's great. I use it all the time. Right? Even if they forgot to use it last night. So that's kind of what this is getting at. It's not saying that people are lying or trying to cheat. It's a human tendency, a human bias. So, but the reason that's important is it really has implications for all these bed nets we're dumping into these countries. Like, are they being used, right? And the number one question I get for whenever I present my work is from policymakers in Uganda, for example, is, are people using the bed nets that we're dumping on their doorstep? And with self-reports, you can't really know. So that's why I moved into trying to come up with better ways of measuring or monitoring bed net use. So the main goal is to come up with a way of objectively monitoring, so get rid of those biases as much as possible, and then also to longitudinally measure, so over the hour of the night, know how many of the bed nets are actually in use. So that would also gather you the timing, like what time people put their bed nets down, what time they go to bed, and also whether there's interruptions in use, ideally, so that you can tell if people are getting out and getting exposed during those times when they get out from under the net. So what that opens up is brand new metrics, brand new ways of thinking about bed nets use. It's not just on, off for a night. Now you can talk about missed nights of use over seasons, variations in seasons, variation night to night. You can actually talk about duration of bed net use, how much exposure, how much prevention are they actually getting, right? Like as a treatment. The timing of use, what time did they put it down? What time did they fold it up in the morning? And then interruptions like we talked about. These are all important because if you think about mosquito exposure is not constant. Mosquito exposure also has peaks. And I'll show you a couple of graphs of that. So the timing of the bed net use, if you use a bed net and there's no mosquitoes around, I don't really care. But if you don't use a bed net, it doesn't really matter. They have to match up, is what I'm trying to say, right? You have to use your bed net when there's mosquitoes around. If you have one or the other, it doesn't really matter. So really it is the interaction between those two that's most key. And that's kind of my most latest work of what I'm getting closer to looking at. So back in 2012, 2010, 2011, I came with the idea of like a tool that you could actually use, a measurement device called SmartNet, The idea was to measure if a bed net was up or down, and then to log that data. So we did some studies, in Uganda. This is in Western Uganda. I was working with MGH, and that's where I did my residency in Boston, and they have a location in Barara, which is in Western Uganda. And so we did some of the initial work for this study. We designed our own little device. These cloth, the way it actually works is the cloth you're seeing there is actually conductive. So if you send a small current through it, you can detect on the other side like a wire. And so what happens is when the bed net's folded up, the system detects that it detects a current going through, so it can tell that the bed net's folded up, as opposed to when it's unfurled and there's no current going through. Very simple. If it detects that, then it basically gives you a 0 or a 1 based on whether there's a conduction, and then it just logs that every 15 minutes. It just says it's up, it's up, it's up, it's up, it's down, it's down, it's down, it's down. And that way you can create a log of basically monitoring bed net use. This is the president of Uganda looking at my net. The guy with the hat. That's Museveni, and this is one of my research assistants, like a health fair, presenting it to him. So whenever I present this in Uganda, I was like, well, the president likes it. So I'm inventing a new technology and I'm trying to roll it out in Uganda. You could say, okay, well, do the people want this? So we did a lot of work around acceptability. Some initial studies we did, some very small publications. We went to a clinic and we found 50 mothers or first-time pregnant women, showed them the bed net, explained what we do, explained what it does, asked their opinions about it. Many were very positive about it. It was a very low stakes situation because they weren't actually going to use it. But in general, they weren't like, oh, I hate that. So in general, they had some positive views about it. There were some questions, as you can imagine, about monitoring, right? We're monitoring people's behaviors overnight. Questions about having these little devices hanging above your bed. A lot of very appropriate questions about what exactly we're monitoring and why. Which again, if you start working in global health, these are like the number one things you need to think about is technologies or approaches that are acceptable to local communities, local understanding of what you're doing. So in every study we do is a lot of education as well. We also did a little bit more of a fulsome look at acceptability. We did a qualitative study in 10 households that were actually using the bed nets. We asked them how they felt about them. We did we did the whole qualitative interviews. Essentially, they were very well. I don't think I have more. No, I don't have a lot of the results of this, but we had quotations of people's experiences with it. There was some inconvenience. Some of that just related to being in a study, but in general, they were well accepted once people understood what we were monitoring and trying to help understand. It was also not about punishment for people. It's not about like, oh, you're a horrible bed net user and you're a really good one. It was about trying to understand the patterns, again, about how bed net use matches up with exposure. That's how we present it to people. So some of the most interesting things that I find about bed net use, which I also try to analogize to toothbrushing, is that people use their bed nets in totally different ways, very heterogeneous ways. So you're looking here at 10 different houses, or about 6 weeks of monitoring per house. Each line is a night, and you're looking from left to right, from 0 to like 42 days. And every time it's black, it means that the bed net's in use, and if there's nothing there, the bed is not in use. And the times go from 6 p.m., 1800 at the top, to 9 a.m., the next morning. So you're looking at nights of use. And you can see here that these don't look the same, right? So they're very, very diverse. For example, household 1 had used it pretty regularly, then left it up a lot of the time, then missed 4 days, then used it more. Household 8, for example, just left it down most of the day. Very wide-ranging behaviors. And this is actually what we see over and over again, is that from house to house, this is even within villages, house to house, individual to individual, you'll see wide ranges of behaviors. My most recent work is trying to classify the variation between like individual behavior variation, household variation, and village variation, because that helps determine some of these patterns and helps public health providers understand who should we target, who should we be focusing on in a community. And I find that part really interesting. I said I analogize it to toothbrushing, but you can imagine there are people that never brush their teeth. There are people that brush their teeth 5 times a day. And then there's everybody else in between, right? So same thing with bed nets. This was showing this is a way of kind of visualizing the interruptions in bed net use. So on the left side, you're seeing households, and on the bottom, you're seeing the hours of the night. And each bubble is, the size of the bubble is how long of an interruption you had. And so you're seeing basically a pattern of interruptions. So a very big bubble means they like used their bed net, then they got out for a long time, then they went back. If it's a small bubble, they got out of their bed net and went back quickly. Just gives you an idea. And again, very heterogeneous behaviors in terms of like interruptions of bed net use. Again, like if you had a 4-month-old baby, right? You'd be getting up a lot to go check on them because they're crying or feed them, that kind of stuff would be a common cause of interruptions of bed net use. So these were looking just kind of like a bed net use by itself. Then the most important part is, okay, so what does that imply for actually getting malaria, right? That's the part that we really care about. So we use these same tools in Eastern Uganda, but also added in entomology metrics where we measure mosquito exposure, right? So we use actual mosquito density that we capture in these little called CDC light traps. They're like these little traps with lights on them that overnight in a room will capture mosquitoes. We also did timing of biting where we have volunteers sit outside at night and mosquitoes land on their leg. And when they land on their leg, they suck them up and they count them. This is the gold standard of measuring hourly exposure to mosquitoes. That allows us, we don't use these very commonly. They're expensive and they also provide some risk for the volunteers, obviously. They also get pre-treated with medications. There's standard ways of doing this as safe as possible. The reason we use them is it's really the only way we can get a sense of the timing, the density over time of how often people are getting bitten at what hour. And that's super important if you're also matching that up with when people are using their bed nets or not, when they're outside or not. So the goal of this study was to actually look at how bed net use matched up with exposure to infectious mosquitoes. One thing that's very common is that school-age children, so that's children like 5 to 15, and young adults, those people like 15 to 30, were actually they weren't very good users of their bed nets. They don't use their bed nets very regularly. Children under 5, mostly because of education and because of understanding of the risk, are much better at using their bed nets in particular, in general. And adults are typically better, older adults are typically better using their bed nets as well. Often they're co-sleeping also because they're in these very small houses. So like a young child of 2 will sleep with their mother, sleep with their parents. That's another way that they get a common bed net coverage. But school-age children in particular are notorious for not using their bed nets very regularly. I would imagine the same is true with toothbrushing. If you have a child that's now 6 years old and go brush your teeth, and like you're not watching them or doing it for them, you can imagine that probably leads them to not brush their teeth as much. Similar thing with bed nets. So in this plot, we were looking at how that bed net use matches up with mosquito exposure, right? So every hour that the bed net was used and there was a mosquito around, I counted that as 0 exposure. But if the bed net was not used during that hour and there were 3 mosquitoes, that's 3 exposures, 3 potential bites, right? And so this is counting up the proportion of potential bites that were averted by the mosquito net. And you can see that there's a slow decline, but it's only about 62%, at least by this estimate. 62% of the bites were actually averted by mosquito net use by the best users under 5 years. So what this suggests is that mosquito nets are not good enough to prevent, certainly not in like regular use, are not good enough to prevent potentially enough exposure to really turn the tide on malaria. That's kind of how I take this slide. All right, we'll go from there. Maybe I'll stop there for 1 second. Questions on that portion? We have like 15 minutes left. Yeah.
Do you find that any of the people were using the nets differently when they knew they were part of a study?
Very good question. Yes, they do. They use them more, unsurprisingly. This is something that comes up often too when I want to use these monitoring devices. It's commonly called like an observer bias. There's something called the Hawthorne effect, which is like a subset of that. That's true. So the evidence I have for that is that households that had these BedNet monitors, they reported using their bed nets significantly more than houses that didn't have them. What we've seen is that tendency seems to decline over time. In this study in particular, we only did it for about 4 months, so I can't say for sure that that's the case. But my theory is that once they start to understand, once they get sick of trying to conform, then they will use a little bit reversion to the mean again, to a little more what they typically might do. Now my device here you saw is like a big behemoth, right? It's got like lines and there's a little like electronic thing. My most recent device, which we'll get to next, is much smaller. It's like the size of a watch face. Again, trying to decrease that, try to get it closer to people's real behaviors as we can. But that definitely is a problem. It is an issue. It's not a problem because it's good for them, but it's an issue in terms of like trying to understand typical behaviors.
Just to clarify, with perfect use, this approach is 100% for all age groups? So
that's a good question. No, you can still get bitten. A perfect use of bed nets, you can still get bitten by mosquitoes. So it depends on how to define perfect use. You can't wear a bed net at 6 p.m. I mean, you could, but you know what I'm saying. So you're not under the bed net at all hours of exposure. Mm-hmm. Secondly, mosquitoes sometimes will just like hang out underneath, like attractions to the odors. They'll hang out underneath the bed net, and then you unfurl it, and there it's there. Mm-hmm. So it's not 100% protective of exposures, even with 100%. This in particular is taking into account sleeping times. So if people go to bed at 8 o'clock, that's probably why like kids go to bed earlier, right? Typically, in this study. So they go to bed earlier, so they get more protection. And the adults go to bed later. And then there's also a really interesting different exposure, like milieu inside versus outside. If you're outside, you get exposed to different types of mosquitoes than when you're inside. And so some of my more recent work is coming up with ways of monitoring that, like where are people at what hour, and where are the mosquitoes, and then putting them together. But yeah, so bed nets are not 100% effective, even if you used it 7 p.m. to 12 noon, you still have like that 6 to 7 hour, which is typically a low exposure, but it depends on where you are and the type of mosquitoes that are around. It's very species dependent. Okay, so coming off this, getting at questions about observer bias, I wanted to find, are there ways we can improve these technologies, right? Get better at monitoring. Some of the challenges we had, the number one right there, may alter individual behavior because it's so salient that we're monitoring people. These actually were pretty complex. We had like a seamstress in Western Uganda that would like make these for us. We'd give her conductive fabric and she would cut it and like, with her little sewing machine in the market, like put them all together. It took a lot of time and it was, it worked, but it was complex and it cost a lot. The battery life wasn't the best. It could only last, I think about I want to say a month for these original ones. Obviously you can't wash them or, really mess around with them too much. And then some people, there's some tampering, people like children would come and like steal the batteries out of them or try to take them apart or, things like that. They had little, SD memory cards like you'd have in a phone or in a camera. And so they would like take those out and I lose all my data. But it happens rarely, but in research settings that occurred. So we wanted to try to avoid or at least decrease some of these things. So a more recent approach was actually pioneered by one of my colleagues at from Liverpool and Cote d'Ivoire, who he actually presented with me this presentation last year, Benjamin Kudu. But they did work using these accelerometers. So just like you have pedometers that people use all the time nowadays, they actually have research grade pedometers. They're called accelerometers that people will use in research studies, mostly around obesity, activity levels. And these are well validated for research studies. But what we did is we took the wristbands off and we attached them to bed nets. And the idea was to look at if we could detect in the pattern of the shaking of the device, what's happening with the bed net. So the benefits of that is it's much smaller, it's out of the box, you just kind of buy them. They're not cheap, certainly they're expensive, but they can last up to 2 months, 3 months, depending on how often you're measuring. And they're water resistant and a little more tamper proof because there's really not a lot of resale for just this random thing that has there's no display. It's just kind of just this thing that sits there. So this was his original study in 2014, and he found that self-reported use again was overestimated about 13%, a number that I had found in the meta-analysis. But they used these initially, I think it was like eight villages in Cote d'Ivoire. And then I got involved with them about 6 or 7 years ago. I was doing my master's the master's in clinical research here at UCSF. And I'd taken a course on machine learning. And so I was able to use machine learning, apply a machine learning algorithm to their data set to try to come up with better ways of classifying their bednet use. They did a study in the UK, in Liverpool, where they had volunteers come in and use the bednet like they would in a household in Africa. So they came in, they're like, okay, now pretend like you're getting into bed, pretend like you're getting out, getting back in, put it up, put it down. We had kids use them. And so we had all that data together. And the benefit of that is you have someone writing down at 11:10 a.m. at 33 seconds, they put the bednet up. It's a tagged data set. And then that is the sort of data you need for a machine learning model. And so we were able to use that to get up to 96% accuracy for detecting whether the bednet was going up or down. And this is actually the model we're using nowadays. When you add in more complicated behaviors like entering and exiting a bednet, the accuracy goes down a bit. But it's still quite accurate, and this is kind of the standard for using this nowadays. Yeah.
Sorry, this might be kind of a silly question, but how do you account for them like closing the bed?
So with my original device, if you tied it in a knot, which is they don't really have any, like if you had a little string or something, like closing it up or knotting it, my original device would detect that because I had different panels on each side. But for these ones, you would have to train it specifically because the machines are stupid. And so you have to train them specifically to understand exactly that behavior. And I don't think we actually have done that. Typically what we do, the very simple case is just up or down. Basically you got it on the side, you throw it on top. The reason we do that is in a lot of these houses, there's very limited living space. And so often the bed is actually where people will sit to eat, or they're actually using that as living space. So they'll often take the bed net and just throw it up, fold it up.
Are you asking because some bed nets have a split in the middle and you can open it this
the
way?
ones that I've seen, you tie them or something. That's
a great question. So I mean, this is very, very specific to the bed nets that I've seen or where we are.
Okay.
And my most recent study in Uganda, we're actually going to houses and looking at what bed nets are there, and then we go back to a lab and we replicate that exact bed net. We try to actually replicate exactly how it's hanging, 3 strings versus 4 and all sorts of crazy stuff. And the idea is to train a machine to be robust enough to detect those differences. So that's a good question. Anything else? All right, we got 10 minutes left. Maybe we'll go quicker through these. So yeah, this is my last study. So most recently, we were funded by the Gates Foundation to use these devices in Cote d'Ivoire. This study's finishing up in the next couple months, but we had 50 houses over 3 different regions in Cote d'Ivoire. And we did about 115 nights of monitoring per house. So that's 4 months on average per house. And so this is just a histogram of the total night hours that people were using their bed nets. You see this very big peak at 0 hours. That's when they just didn't use their bed net. And then you see kind of an interesting stepwise increase of total night hours. I think we defined that as 15 hours. I think we did 6 p.m. to 9 a.m. the next day, so about 15 hours. And then in this plot on the right, what we did is each of those colors is a different region. So Tiasole, Zata, and Klokakaha. You can see those at the bottom. So each of these are houses, and we plotted the total night hours on the y-axis against the number of nights that people miss. And the idea was trying to look to see if there was like a relationship between those two, because if the relationship between those behaviors, right? So the lower number of hours per night should be more correlated with missing a lot of nights. Maybe you're just not a good user of bed nets. And there's a kind of a linear tendency there. That big yellow dot is kind of the mean, the average for everybody all together. But you do see some clustering of different colors, and that suggests that, for example, Klokakaha, the blue dots, they kind of act more similar than the red dots. You get some clustering. And again, so that's like village or region level clustering and behaviors. So if I was a public health professional and my job was to improve bed net use, it's called social behavior change. You'll run into that a lot in global health. I would have a different message for the red houses here than I would for the blue ones. In particular, I would want to learn from the houses that are using the bed nets really well and figure out, well, what can we teach the people that are not using them really well? And that could be a whole field of study to try to figure that out. And that's also one of the virtues of this device, because it helps you, this monitoring is allows you to come up with, again, those like locally targeted approaches. And then this one is important because this gets closer to what I was talking about, a matching up of mosquitoes and human behaviors. So each of those, this is by hour of the night across the x-axis, and the y-axis, well, it's two different things, but essentially it's looking at like bed net use is the histogram, and then you see the line. The line is the peaks in exposure to mosquitoes. And the important thing here is that Zata and Tiasole have a pretty classic like midnight to 2 a.m. kind of peak in mosquito biting. But if you look at Klokakaha, you see an earlier in the evening spike. These are all on the same scale, importantly. So you're seeing that's a lot more exposure that's occurring from 6 p.m. to 10 p.m. in Klokakaha as compared to the other two regions. And lo and behold, when you go and look at this, that's because they're actually a different mosquito species that are there, or more of a predominance of a different species. And all those species have different, each of the species have different affinity for biting humans, and because of that, they carry infection at a different rate also. So it gets complex, but it allows, again, health professionals to say, oh, in Klokakaha, we need to do something other than bed nets because a lot of the exposure there is occurring between 6 and 10 p.m. Whereas in these other houses, maybe we need to just improve people's late night bed net use, and that will help cover their exposure. You can get really targeted when you match these up. So what are these lessons? There's lots of ways we can improve bed net education and malaria prevention. So bed net use also is determined by mosquito density, but it's still not zero even when there's very few mosquitoes around. You can still get exposed. Age is a really significant factor, both in the risk from malaria and in behaviors related to preventing malaria. I talked about school-age children in particular. And then typical bed net use only protects against about 50% of exposures in the study that I did. So maybe we need other tools. I'll mention those because I don't talk about it later, but there are other tools like spatial repellents, which actually some people here at UCSF are working on. There are attractive toxic sugar baits that like attract mosquitoes outside and then kill them. There's lots of other approaches. There's IRS, where you actually spray insecticides inside houses. That'll kill the mosquitoes before they bite anybody. There's lots of different approaches. And as I've been mentioning, a lot of our investment's been going into bed nets. So maybe we need to think about investing a little bit stronger into some of these other approaches. Certainly in places like Klokakaha that are getting their exposure outside of your bed net times. So these are just some of the next questions. You know, why do some people use their bed nets really well or not very well, and then their neighbor is the opposite? And so we've done some qualitative interviews. We've actually done some interviews with children that we're going to publish soon that looks at like narratives around bed net use. Can we improve the accuracy and the specificity of what the bed net monitors are actually detecting? So I'm working on that in Uganda right now. And then we're trying to roll these out in other countries. So I'm using in Uganda. We're trying to get a follow-on to our Gates study to do more in Cote d'Ivoire. And then the President's Malaria Initiative, which is kind of like it's like the PEPFAR for malaria. PEPFAR is for HIV. It's like the big US government funding for malaria. They're actually really interested in these devices because they're the #1 funder of bed nets in the world. And they're wondering if they're getting the bang for their buck. This is a great way to try to understand that. So we're going to be doing a project in Cameroon and maybe Benin in the beginning of next year as well. So for you all, as you start in your career, malaria is a significant cause of mortality in Africa, in particular in children. Bed nets are one of the most widely distributed tools for health prevention. There's a lot we don't know about malaria transmission and how it interacts with mosquito exposure and human behaviors. Obviously, socioeconomic circumstances, cultural diversity, individual behaviors, it's a wide open field. And that's what my work tries to focus on. So thanks for your attention. And I will say also, I had a Pathways mentee previously. If anyone's interested in my work, please get in touch with me. It's paul.krezanoski at UCSF. I'm now here more full-time. I'm hoping still to travel to Uganda, but I lived in Uganda for the last 2 years with my family, but we've moved back now, so I'll be around, and I'd be happy to help you come up with any kind of projects related to malaria or anything else you're interested in. Thank you, guys.
We can open up for questions, in the room, and then for those online, if you want to put it in the chat. I can read it for you.
On the last slide, you talked a little bit about the characteristics associated with bed net use. I imagine there was random sampling when you're selecting these households, but is there a variability in the underlying characteristics of the communities you studied in terms of housing quality, education level, and what have you teased out in terms of the key indicators on that?
Yeah, so we talk about like barriers or facilitators of use. So some common ones that come up are certainly socioeconomic status, like wealth indicators. That one seems to be associated, so higher wealth seems to be associated with better net use in a lot of studies. It's not clear exactly why, whether that's a proxy for education or whether it's a proxy for agency, like just people are healthier, so they're able to actually go get a bed net and have this attitude that if I can prevent malaria among my family. Or is it a proxy for just having more bed nets available? There are a lot of different ways to think about that. Housing structure is another huge one. So having a permanent house structure, obviously, but then even traditional homes, which, as you can imagine, I'm talking about all sub-Saharan Africa, it runs the gamut, right? Traditional homes are like what they're made of, what the local structures are. In Uganda, they have something like, I want to say 60, it's probably more different like local tribes, and you can go to the museum and see like 30 different hut types, right? So those actually have a lot of implications in whether mosquitoes can get in, how they get in, and that actually implicates bed net use and malaria prevention also. So and there's a big push now for helping people move towards what they call more modern homes, which are like cement floors with like more like solid structures. But that's, you can imagine expensive and is it culturally acceptable? A lot of different challenges with that. But it's a way to prevent malaria, certainly. The other way to prevent malaria is to put in parking lots, which is what my mentor said once. So if we want to just develop the entire world and just wipe down all the trees, we can get rid of malaria. Kind of what we did in the US. Clearly we don't want to do that. So hopefully there's a better way. But development in particular, urbanization. So I lived in Kampala with my family. We took malaria prevention for about 3 months, and then we kind of gave up because there's no malaria in Kampala, or very little. But whenever we traveled outside of Kampala, we took malaria prevention. So Urbanization and rural versus urban is another big one.
This is definitely silly, but what about like bug spray?
Yeah, good question.
Do we give out
No, I mean, so insect repellents, right? And so there's a lot of, I mean, you see them, maybe you see on ads in the US, like, use these to prevent malaria, bug zappers, that kind of stuff.
Yeah.
Bed nets are meant to be a middle ground because they're not as expensive as rolling out bug zappers all across the country. The bug spray repellents, low cost, non-toxic repellents that can be produced at scale we're talking about is not quite been achieved yet. And is it culturally acceptable and can we get people to have those behaviors and habits? They work. I mean, people use DEET and you get less mosquito exposure, certainly. Or another one is insecticide impregnated clothes. My brother came to visit us in Uganda on safari and he had these great clothes that had insect repellent actually impregnated them in the cloth, just like they impregnate them into the mosquito net. And those were great. They're just not something we can do at scale for a billion people. Or not in a coordinated way, certainly.
Well, thank you very much. Yeah, really glad to have you back in.
Yeah, I'm glad to be back. Yeah, please get in touch. I like working with. I need to build up a group of mentees now that I'm back. So I'm happy to talk about any of this stuff.
Thank you.
Thanks, everybody.